Good afternoon and welcome to our first COVID briefing of the new year. This one is on supporting our university community during the spring 2021 semester. I'm Robin Kaler, Associate Chancellor for Public Affairs. I do have a quick reminder before we get started introducing our panel. If you would like to use CART live captions for this event, please open a new window on your browser and visit go.illinois.edu/spring 2021 briefing. Again, that's go.illinois.edu/spring 2021 briefing. And that will get you the browser that you need and the captions you need to be able to follow along. Our panelists today are Chancellor Robert Jones, Vice Chancellor for Academic Affairs and Provost Andreas Kangalaris, Vice Chancellor for Student Affairs, Danita M.B. Young, Associate Vice Chancellor and Dean of Student Support and Advocacy, Stephen Bryan, and Executive Director of Public Safety and Chief of University Police, Alex Carey. And again, if you want to start using the captions, open a new browser, go to go.illinois.edu/spring 2021 briefing, and you'll be able to follow along with captions. We do have a long list of questions today. You've had a lot on your mind over the holiday. So we're going to ask Chancellor Jones to make some very brief opening remarks, and then we're going to get straight to the questions you've been asking. So Chancellor, could you please unmute yourself and then get us started? That darn button is tricky, isn't it? Oh, you're still muted, I think.
Okay.
There you go. Yay.
Right. I tell you, sorry about that. Let me start by saying, first of all, thank you, Robin, and good afternoon to each and every one of you. I want to start by saying thanks to my colleagues for joining me today for this latest edition of our COVID-19 briefings. We have a very long list of questions that we think is critically important to cover. And so we think it's important that we provide as much information for everyone to know about this new semester and what we will be doing to once again keep our communities safe. So I'm going to keep my remarks short. I know that the perspectives of the COVID-19 vaccine has been really welcoming and exciting news for every single one of us that's in this community. I think we also realize now that this is an evolving process because all of you probably have heard in the last few days, there's been an announcement from the incoming administration that's going to make more of the vaccinations that have been withheld available immediately. That is certainly something that's going to be critically needed. And just today, I heard that there is going to be a reconsideration in terms of getting tests available to as quickly as possible for everyone over 65 years of age. So all of that is certainly welcoming news. And it really does seem like with all of these things that there's finally some light appearing at the end of this apparently never ending tunnel. So there's light at the end of the tunnel. But as we start this semester, I think it's critically important for all of us to really begin to understand and to remind each and every one of us that that light, the end of the tunnel, is still months away, and that we have to really be more vigilant than we were perhaps in the fall to do all those things that we know by now were best practices that help us keep this community safe. So throughout this semester, each and every one of us in our community, until we've all been vaccinated, until we get that level of herd immunity that we can start to think about returning, I won't say to normal, but to pre-COVID-19 activities, we really do have to buckle down and continue to be very, very vigilant. Our testing requirements are still in place. Social distancing, facility access is still going to be controlled and limited based on the protocols that we established. And we will continue to enforce our student disciplinary practices and our employees' rules just as we did the first semester. I'm going to not repeat that again, but it bears repeating. This is critically important that you understand that we are taking this very, very seriously And you're going to be hearing more about this in the days ahead. So the take-home message, we cannot afford to relax now. We must continue to do the very hard work that enabled us to navigate the first semester. We learned a lot of things as we went through that semester, and we're going to build on that knowledge, that information to help keep all of us safe and to have a better experience this semester. So I know we're all tired. We're getting a bit of COVID-19 fatigue, but we have to hold on for a little while longer and remain diligent and remain as careful as we go about our critically important work during perhaps the most dangerous period of this pandemic. And we can't say enough about this. So continue to emphasize keeping each other safe. And I think if you keep that at the front of your mind, we will be just fine. So with that, thank you for again participating in this briefing, and we'll turn things back to Robin to get the questions started.
Thank you, Chancellor. I think if you can't watch the rest of this, just go back and watch what he just said again. I think you're going to get the gist of the really high points of what we're going to talk about today. That was great. Thank you so much. And again, if you want to use the live captions, go to open a new browser, go to goillinois.edu/spring2021 briefing. And now let's get right to the questions. So Danita, let's start with you. Fall 2020 was unlike any semester we have ever seen. As the Chancellor said, we learned a lot. Can you talk a little bit about what you learned and how that is going to influence or change what the next semester is like?
Absolutely. At the close of the fall semester, the university conducted a student experience survey to better understand students' campus experiences and their expectations for this spring semester. And some of the key takeaways included the need for safe ways to gather for social activities, that students didn't fully grasp how challenging isolation and quarantine would be. And they told us that they faced emotional, mental health, and wellness challenges. So as a result, we will continue conducting the online gatherings, face-to-face activities when possible. Also, I know within university housing, they're continuing to open up and offer their lounges, the lobbies, the dining spaces within the room capacity limits that are set to ensure that our students have safe spaces to come together in dialogue. We also improved upon our quarantine and isolation intake protocols, the sanitation and turnover processes within the halls, and the meal delivery program as well, to help our students who are living in university housing and outside of university housing navigate that isolation and quarantine. So those practices will continue this spring. And then finally, you know, our campus is really a community of care. And when our students, our faculty, our staff, they face emotional or mental health or wellness challenges, we do take those concerns very seriously. And so we will continue online counseling services and 24/7 emergency support, as well as workshops, online suicide prevention training, and mental health screenings. But we also have created some new resources that we will be rolling out very soon.
Thank you, Danita. And we'll talk more about those mental health issues and what we're doing a little later, but let's kind of go back and start at the beginning. Robert, we hear this next question a lot, so I want to get it out of the way right away. If I didn't have contact with anyone who had COVID over the break, do I still have to test when I get back?
The answer is yes, primarily because there's no way for you to know unequivocally whether you've been in contact with someone with COVID-19 or not. And so our protocol that we've established is very, very clear. We expect all of our students to come back to campus in a timely fashion to deliver 2 negative COVID-19 test results prior to the first day of class. And so that is an absolute requirement. And I want to emphasize an absolute requirement. This is not some big idea that someone pulled out of a hat. This is based on scientific data, based on research. And we think that this is clearly one of the best ways to assure that we get off to a safe start with mitigation and detection of those that are positive before classes start on the 24th of January. So that is a requirement, regardless of whether where you've been in the world during this period. You must test, deliver 2 negative tests before the beginning of class.
Thank you. And so that's testing. Stephen, in the fall, also, as we know, everyone had to wear a mask and social distance and all that sort of thing. Is that still required in the spring?
Absolutely. All students, employees, and visitors must wear a face covering in any university building, facility, and classroom unless they are physically isolated in a private space or room. Face coverings must also be worn in all public places and settings on campus where social distancing of 6 feet cannot be maintained. And this includes outdoor spaces on campus and situations such as traveling to and from classes or events.
And during fall, obviously, we had restrictions and expectations about gatherings. Are those still in place? I assume yes.
Yes, so expectations for in-person events are based on the guidance from the Restore Illinois plan and public health officials. The university follows the state's Tier 3 resurgence mitigation plan, Phase 4 guidance, and the cities of Champaign and Urbana's emergency orders limiting attendance at in-person events. And it's important to note that under the governor's current Tier 3 resurgence mitigation executive order, in-home gatherings are limited to household members. So what that means, for example, is that those who are living in a group setting, such as a fraternity house, may not hold gatherings that include individuals who do not live in that house. So non-compliance concerning hosting of or attendance at events or parties that places individuals and groups at risk of university of disciplinary action should those occur. And that could result in a student's dismissal from the university or revocation of a group's registered status.
Those are pretty serious penalties. Thank you. Chief Carey, as we talk a little bit about safety and discipline, can you talk about what new safety measures UIPD has in place for the spring semester?
Absolutely. Having recognized that mental health support is such a critical resource across all campus units, the University of Illinois Police Department is expanding and enhancing the way it responds to mental health emergencies. UIPD has formed a response, evaluation, and crisis help team, REACH for short, which will be staffed by specially trained police officers and social workers who will be available to respond to mental health emergencies, like when someone's in immediate danger of hurting themselves or someone else. By having social workers embedded with this team and responding to calls with police officers, REACH will be able to make treatment decisions in a timely manner and in a way that ensures the safety for everyone involved. REACH team members will also train other patrol officers to give them additional decision-making tools in the event they encounter someone experiencing a mental health crisis. REACH will become a wraparound service that works with established community partners to ensure that our students have access to mental health resources they need and they don't slip through the cracks. We also have a new resource for our campus community members who may be experiencing milder levels of anxiety or stress. Recently, we brought 2 additional therapy dogs home to UIPD through the Paws and Stripes training program. Canines Lollipop and Winston will join Archie to make 3 canine therapy dogs available through UIPD. Our students, faculty, and staff will be seeing these dogs and their handlers across campus as semester moves forward, and we hope they can take a moment to interact with the dogs and de-stress a little bit.
Sounds great. And you do a lot of managing of parties and gatherings. How will that work this spring?
Yeah, we do. And we felt that, the model we employed during the fall semester was as effective as it could be. And we plan to stick with that. And it starts with education. We'll be out there talking about the importance of keeping gatherings very, very small and complying with our local public health regulations. We have seen that most of our campus community members heed that advice and act in good faith. That's really what we want to see, our students taking responsibility for this on their own and doing the right thing. However, We know from our experience last semester that not everyone will feel the same way, and we'll expect to see parties and large gatherings again as we did in the fall. When that happens, our first step is to send our student patrol officers to those gatherings and ask the party host to come into compliance with the regulations under the Restore Illinois plan. At this moment, that means no in-home gatherings that include people outside of your household. We feel that peer-to-peer interaction is very important. Most of the time, this step is effective without any need for police involvement. Unfortunately, sometimes the party hosts do not comply voluntarily, and that's when our police officers do respond. Situations where police officers had to get involved and write citations or levy fines were relatively few in the fall semester, but they did happen. Party hosts in violation of local public health regulations are liable to be ticketed for hosting a nuisance party, reckless conduct, and endangering public health. Some of the fines from the fall semester were in excess of $1,300 per individual party host. Again, we saw that last semester the vast majority of our campus community wants to do the right thing and protect each other. But we do have that mechanism to enforce health codes in case we need it, and the fines for violations can be steep.
Thank you, Alice. Stephen, I know we had some students, as we've said earlier, who struggled through the semester. And if a professor, an instructor wants to help a student, and they see that a student is not at a class and they have not given notice they were not going to be at a class, what should that instructor do?
Absolutely. So first, if you feel that a student is in danger, the first number you want to call is 911. But University Police can also be reached at area code 217-333-1216 for non-emergencies. Faculty and staff can also reach out, and really anyone can reach out, and I'm going to put it up here on the screen, to our Student Assistance Center at helpdean@illinois.edu or at 217-333-0050. I want to emphasize that no concern is too small to reach out to the Office of the Dean of Students and through the Student Assistance Center for us to collaborate with you on, to problem solve, and to check in on our students. So please do reach out to us.
That's great, Stephen. Thank you so much. I'm going to ask you every time you speak if you can put that back up on the screen for us, because that's really helpful. Again, anyone can call 217-333-0050 to get help. So if you're not sure where to go and you go there, if they're not the right place, they're going to get you to the right place. Correct? Got it. Thank you. Danita, if a student wants to talk to a counselor, what do they do? We have heard on social media that some students say you can't get an appointment with the counseling center on short notice. And I think you've told me that that is not necessarily correct.
You're absolutely right. That is not correct. But first of all, if a student feels they or their fellow student is in danger, they should call 911. You know, that is always going to be the first line, call 911. We know that our demand for mental health services has increased dramatically, particularly during this pandemic. But we continually make efforts to ensure as many students as possible receive assistance. And in response, we have increased our counseling center operating hours until 7 p.m. on Wednesdays and Thursdays. And we have appointments available for students who are in crisis. We will always have appointments available for students who are in crisis. But additionally, students with United Healthcare can access online counseling services via telehelpforstudents.com. So we have also increased the number of emergency deans available to support our students who are experiencing health or safety emergency situations in which an immediate university response is needed. So a staff member is always here to help our students 24 hours a day, 365 days a year. And if you didn't capture that information that I said, it is also going to be on the COVID-19 website. All the information that we share is on that website. So it's always readily available.
And Danita, we do have a group, you and I are leading it, that is working on mental health. And can you just talk real quickly about, you're excited that that's going to have some new and enhanced ways to help people?
Absolutely, yeah. So we have a coordinating team that is campus-wide that includes our students, staff, and our faculty, and we're really working on prevention and wellness approaches and strategies for students, for faculty, and for staff members. We are creating a clearinghouse, if you will, for resources, looking at how we're messaging out to individuals, helping them understand that there doesn't need to be any shame associated with mental health or how you're feeling or anxiety. And so we're going to start to roll out some of the information in the resources and the creative strategies that our students, staff, and faculty have kind of worked so diligently in the last few weeks to make sure that we, again, have this community of care, that we are paying attention to people's mental health, so that they can be successful in their day-to-day lives and really thrive. And it's okay to ask for help. That's our message. It's okay.
Absolutely, that's perfect. And then obviously students have physical illnesses occasionally too. If a student isn't feeling well and it's after hours from McKinley, where should they call?
Again, also, it's that theme of calling 911. So students should always call 911 for all life-threatening and emergency situations. I want to put that out there. But otherwise, we do have, our registered students can call Dial a Nurse at 217-333-2700. That again is 24 hours a day, it's 7 days a week. All the calls to Dial a Nurse are confidential. And they are located within the student's McKinley Health Center medical record.
Great, thank you. And Stephen, we are hearing from some students who say they are experiencing technology problems. And I know we helped a lot of students back in the fall and even in the spring with technology. But I think it would be worth repeating again. What do students do? For example, does the university have laptops now that we can lend, that sort of thing?
So whether you are studying remotely or coming to campus for the spring, students who do not have access to a functional computer or reliable internet connectivity, whether at home or here on campus, please contact the Student Assistance Center. Again, the graphic there is our contact information, help team at illinois.edu or 217-333-0050. We want to make sure that you have access to the technology you need to be successful.
Great, thank you. And Danita, we know food insecurity is a growing problem all across the country during the pandemic. If a student at Illinois needs help with groceries, is there a resource on campus for that?
Yes, there's definitely a resource that we do have on our campus. And that's one of our goals, definitely, is to ensure that our Illinois community has access to nutritious food and the key necessities in welcoming and educational space. That is very essential. Food is very essential to a student's success. So in the fall, we as a university launched a food assistance and well-being program. And this program offers free shopping style pantry that is open to all of our students. And that pantry is operated out of the instructional kitchen in the ARC. The program also provides students with information on how to sign up for the Federal Supplemental Nutrition Assistance Program, also known as SNAP. But that is something that I know our students, they are helping run that program, and they really advocated for something for their fellow peers because we know it is a tremendous problem in our community. And I'm very proud of the fact that this pantry was begun.
Thank you. And we've talked quite a bit so far about the things that are different because of the pandemic, but students are telling us that they really want to have some normal college experiences, things like the concerts and the movies and the other activities that Student Affairs plan for the fall. Can they expect any of that sort of thing for the spring?
Yes, absolutely. Just like we've been talking about, we do have these guidelines, but students can expect that the campus will have both in-person and virtual activities for students, of course, based on the weather and our state guidance for events and gatherings. You know, typically we do see a slight decrease in, you know, outside large gatherings in the winter months of the spring semester at anyway, but people are still planning some smaller activities within the guidelines and of course the virtual activities, and they can visit the website, which is go.illinois.edu/activities for more information.
Great. And if you're asking for ideas, I would advocate at the first big snow, we have the world's largest snowball fight, socially distanced on the quad. How's that? There's
I will send that to our RSOs and our student success and engagement team. So
great. Thank you. Just my little contribution there. There you go.
Okay.
And Robert, and I hope you'll participate in that, Robert, because I know you have a really good arm. The question of the month, though, Robert, is when can I expect to get vaccinated?
Well, let me say, first of all, Robin, it's probably going to be a very, very small snowball, so I'm all in. To the question of the month, yes, CU PhD, as we all know, is leading the vaccination distribution for all of Champaign County. And the university will continue to share information in this regard as it becomes available. Because as I said in my opening remarks, there have been a couple of decisions that clearly is going to impact that distribution about having to do with the increased availability, hopefully that we'll have more doses to be provided to our community. And if in fact, we have to implement a strategy to test everyone over 65 years of age. If that gets to the top of the list, we will certainly keep you informed. As you all know, Michael DiLorenzo, who chairs our COVID-19 Executive Steering Committee, has been working with all of the anchor institutions here in Champaign County, not only CU PhD, but Carl and Christy and OSF and others to map out what is now this community-based approach with 2 locations where vaccinations will be delivered. And so stay tuned, continue to please check our COVID-19 vaccination page to get the most updated information. But we also know that a large number of our employees do not reside within Champaign County. So you're going to have to take the responsibility for seeking out what the schedules and the protocols are going to be for the actual counties in which you reside. We also just want to emphasize at this juncture, CU PhD doesn't anticipate that the vaccine would be widely available to the community until spring. We are going to be pushing and hope that's going to be early spring, but those are the guidelines that we have at the moment, and we don't know which group is going to be listed in prior to be tested, but as soon as we get that information, it will be forthcoming on our website, and if necessary, we'll communicate it by mass mail if that is required. But please pay attention and stay tuned and be ready to make your appointment to get vaccinated as soon as possible.
And isn't it just happy that we're having that conversation? Yay.
It's a wonderful conversation to have. Absolutely.
Absolutely. Thank you. Andres, when people do get the vaccine, will they still have to participate in the on-campus COVID-19 testing program?
Robin, the answer is yes. We are fortunate to have one of the most comprehensive plans in the nation to mitigate and reduce the spread of COVID-19, and the vaccine will be one part of this plan. Until our medical community has a better understanding of the impact of the vaccine in preventing disease spread, all our members of the community will have to follow our university COVID-19 testing requirements. Again, as we have repeated several times, people who don't will be subject to disciplinary action. And it is very important to remember that we have a comprehensive plan that provides us with a unique opportunity to mitigate and manage COVID-19. But that requires everyone's compliance with the expectations and guidance by our university.
Great, thank you. And Andres, I mean, the saliva test developed at Illinois was one of the earliest things that somebody did that was innovative during the pandemic. Were we too early to have our test be able to actually now detect the new variant of COVID-19?
Actually, the great news, Robin, is that the saliva test we've developed here detects the coronavirus and all the new variants that have been identified today. This is one of the things that our chemists looked into right away. And we are very excited and fortunate to say that the B117 variant is something that we can detect, and we are in the lookout for it.
That's great. Shout out to our SHIELD team. That's pretty amazing. Thinking of things before they even happen. So yay. So Stephen, let's talk a little bit about discipline. How are we addressing parties and socializing in the coming semester?
So I think it's important for students to pay attention to the expectations for gatherings that are sent via mass mail. And I know sometimes we can get fatigued with what seems like endless mass mails, but it really is critical information. And that's information that students will be held accountable to. Our offices that advise registered student organizations, including our fraternities and sororities, will be also reaching out to student organizations and these groups about the university's expectations for hosting events, and staff review organizations' safety management plan for safe gatherings. When a student or group is reported for non-compliance of COVID expectations, our Office for Student Conflict Resolution pursues the matter for possible disciplinary action under the student code. The seriousness of the violation is considered in potential consequences. So students who host large gatherings should anticipate dismissal. This past semester, over 2,700 students were reported for COVID violations, and to date, 50 students have been dismissed and 11 organizations sanctioned.
And Stephen, can we clarify one point? We have heard from a few people, kind of a myth buster moment here. None of the students who were dismissed for missing one COVID test, were they?
Correct. Missing one test will not get you dismissed from the university, but a pattern of conduct will.
Great, thank you for that clarification. And Robert, if we learned anything last year, it was that this is an evolving situation and we can't carve our plan in stone. Do we know enough now that we can get those stone carving tools out?
Not quite yet, Robin. As we did in the fall, the SHIELD team will provide guidance to this university leadership in real time. I'd like to remind you that it's because of the fact that we're a world-class research university, as was alluded to a moment ago, the fact that we were able to stand up an entire ecosystem, testing, contact tracing, et cetera, that kept us safe. And so we had to make several adjustments. Those were not adjustments that we just pulled out of thin air. They were data-driven adjustment based on the analysis from the SHIELD team, other information that we gathered from around the nation and around the world. And we will continue to make adjustments in our plans as necessary to maximize the safety of our students, faculty, and staff in the greater community in the spring. And we will continue to communicate any changes quickly. And we once again call on you to respond quickly to whatever changes we're suggesting. And it's not because we don't necessarily know what we're doing, but this is a very dynamic process that's data-driven. And because of that, we have to make changes sometime rather abruptly in order to keep us on the right path. And so finally, let me just say, I can't emphasize enough, and I try to do this each and every time I'm asked in the public forum about what we've done at this university last semester. I just want to thank everyone for the overwhelming show of support for our programs, our practices, and for participating in our testing and our tracing, isolation, and quarantine as needed, and especially for understanding and being patient as we adjust to fight COVID-19. It was absolutely required for the success that we garnered the fall semester. Is going to be required even more as we embark on a successful spring semester and the completion of this academic year, unlike no other in the history of our country and the history of the world. So thank you.
Thank you very much. And you guys are really quick. You got through the bulk of the list of questions we had already. So I would like to just throw out a couple of more. If you could give any kind of message, one single message to students this semester, what would it be? And Danita, I'm going to pick on you first. And since you're the Vice Chancellor for Student Affairs, what would you want to say to students about the semester?
Well, I would absolutely say, you know, we are all in this together. And I would want to make sure that our students in particular are adhering to the expectations that we set forth, making sure that you're, you know, social distancing, wearing your face coverings, doing your testing, but not just, you know, yes, we want you to take responsibility and to make sure that you are staying healthy and well. But also doing it for the community and making sure that we are holding each other accountable. You know, it just reminds me, if you've ever flown on an airplane and, you know, before we take off, you know, the flight attendant's talking about in the time of an emergency or a crisis, make sure that you know, put your oxygen mask on first before you assist others. So you've got to make sure that you are taken care of, that you are well before you can help take care of the other community. We've proven that we can do this. We've proven last year that people can band together, they can follow the guidelines and the expectations to stay well. And we are here. We have defied a lot of odds. So I'm very proud of those students who did stick to the plan, and the faculty and staff who did adhere to the guidelines, who wanted to be here in this community, to wanted to have a true student experience to the best as possible during a pandemic. But I think that, you know, we are very hopeful for a spring semester. And if you need help, do not be afraid to ask for help. I think this is where students, you know, they fall short when they feel fearful that they won't ask for help. But I am telling you, it's okay to ask for help. This is why we are here. We want you to be successful.
Thank you very much. Alice, you're the newest member of our team. I'd be curious to hear your perspective.
I just would like to have students know that we're here to help, you know, and they're our greatest resources in helping keeping our campus community safe. We only ask that, you know, the students step up, you know, to try to help one another so that we can all remain safe, you know, and we're going to be here as that support mechanism to give the students the tools they need to remain safe and be responsible. So, you know, it's a big undertaking to ensure that we have a safe environment, but it takes all of us as a community together to ensure that we remain safe.
Thank you. And Stephen, as Dean of Students, as part of your title, what would you say?
Well, I just want to piggyback on what Alice and Danita says. You know, it's clear that, hopefully it's clear that we are a community of care, and we care tremendously about all of you in our community. And, you know, I've just completed my first year here. And one of the things that I've seen is that anyone is willing to help you no matter what, if you just ask. And I want to encourage you to look for authoritative sources of information. You know, there's a lot of disinformation out there, whether it be on social media or whatnot. I heard repeatedly during the fall semester a myth that students could never get an appointment scheduled for the counseling center. And my colleagues in the counseling center tell me that if a student is in crisis, they will be able to be seen that day. So reach out, find out for yourself directly from firsthand what the sources, what the answers are, the right answers to your questions. Certainly there's value in looking to the experiences of our peers, but definitely reach out to all of us. And again, you see on the graphic there, the Student Assistance Center is one source of information and assistance. Please reach out to any and all of us.
That's great. Thank you for the reminder. Andreas, how about you?
Well, everything has been said. Maybe I could add that all I would like to say is that I want the students to be healthy, to be vigilant, to stay compliant with their testing. It's very important. The vaccine is coming, but testing is going to facilitate our progress toward the ultimate goal, normalcy. And I will say then, please stay positive and keep testing negative.
I think you might have just stolen what the chancellor was probably going to say. Robert, how about you?
Let me just say, I think the only other thing to be said is that we've demonstrated last semester that we can be successful. And as I said earlier, we will be successful the rest of this academic year with you and with all the support from the University of Illinois.
And Robert, I would like to take just a moment. You've worked on campus a lot of the fall, as have several of these folks, and you've made a point of walking around and trying to safely interact with students. What are some of the things that you're hearing? Tell us about a few of your encounters with students.
Well, you know, those encounters have been just really absolutely amazing, in many ways not surprising, given the nature of our student body, who genuinely, I think, appreciates the fact that they have an administration, they have faculty and staff who genuinely care about their well-being. And as I move about the campus, as I walk on the quad, and my most recent event was just before we went away for the holiday break, was to finally make a visit to the downtown Target, as I call it, you know, block from my office. I hadn't been in there, and decided it was time for me to go take a look. You know, since Target, many reasons to be interested. Target started in Minnesota, and it was my son's first job when they first got started out of high school. And so I had many connections. But so I was in there poking around, being nosy, and I had only been in there about 5 minutes. And one of our engineering students came up to me and said, which is a question I get a lot, because maybe thank God I don't look like my video image. They always want to know, aren't you Chancellor Jones? And I said, yes, I am. And this young lady went on to just, I think, exemplify the gratitude that a lot of our students have toward all of the hard work that we have put in place to keep the university students, faculty, and staff safe. And those were almost her exact words. I just want to thank you and your team for keeping us safe and allowing us to compete this semester. So I thanked her and decided it was time to go check out the fresh and frozen food department. Went downstairs and saw this young lady with a red Target shirt on. And she stared at me as well and came up eventually with a pack of frozen food in her hand and said, Chancellor Jones. And I noticed her name was Savannah. I just want to say to you, thank you for all that you've done to keep her safe. I said, do you know that young lady upstairs? Did you guys rehearse this? And she said, no, I'm not sure what you're talking about, but I just want to let you know how glad I am to be part of this university and for all the work that the university did this semester to keep us safe. And Robin, that pretty much says it all, because when Andreas was pushing us on thinking about how to bring this community back safely, it was all about keeping our students and the rest of this university community safe. And we know that that's their perspective is probably not held by 100% of the people at this university. But each and every time I get that kind of personal testimony from our students and from our faculty and staff as well, it really does send a very strong message that it has certainly been worth it all, and that in many levels we have been successful where a lot of other places have not been, in keeping our community safe. And so I just ask all of us, we got one more round to go, and let's all step up to the plate and really knock the ball out of the park as we work collectively to complete the spring semester in a very, very successful way.
Thank you. And speaking of that, then Andreas, I'd like to turn to you for just a moment. There are going to be some challenges. We know from the modeling that's been done, from the analytics, the SHIELD team is telling us that that first couple of weeks is a really, really difficult period. Can you talk a little bit about what we're expecting and what we need students to do to make sure we can get through that together?
Yes, Robin, and I must emphasize that our SEAL team is going through all the, if you wish, forecasting of how the surge of the pandemic in the nation is going to manifest itself as our students will be coming back, and providing us with the guidance of how to best prepare ourselves to get that reentry as safe as possible. But some of the things that I know we will be asked to do, we have practiced them last fall, and that is when you're back to campus, do not rush out to get to meet your friends. Take your time, go through your testing. Those 2 tests that we are asking you to get to be negative should be done during a period where you stay the course, you stay in your room, you limit your movement around the community until you find out what the state of things is. We want to make sure that everyone respects the fact that the first 2 weeks are always busy weeks. People can't wait to say hi to their friends. Use your cell phone, give them a call, send them a text. Don't rush to go and meet with them and have parties. As we heard from Chief Curry, these are some of the things we're going to look after very carefully. The last thing we want is for students to find themselves in a situation where they won't be able to start doing the things that we want them to do, in-person learning and so on. So the first couple of weeks, as soon as you're back, make sure that you smoothly engage with the community. You're respectful of the fact that this is a community with one of the lowest positivity rates in the state of Illinois, not the nation. Contribute to that. Make sure that you do your part because you have that privilege of having access to the test on campus so frequently to make sure that nothing changes. On the contrary, as you progress through the semester, you contribute to that commitment to having our community behave as one of the most responsible COVID-19 communities in the state of Illinois. Again, I look forward to the time when everyone will be able to get vaccinated. And I know that the more attention we pay to testing, the faster that moment is going to come to our community.
Thank you. Stephen, any thoughts from your perspective on that?
No, and as I was hearing Andrea speak, it just really made me want to be appreciative of all of our students' efforts, our faculty and staff. We have overwhelming commitment to our testing program and the expectations here. We overwhelmingly want to keep our students safe, and thank you for the role that you're playing in that. And I also want to thank our student leaders, the influencers. Back in the fall, I rode around with UIPD a few nights just to see what the social scene was like. And I think the biggest influencer of behavior is each other, our peers, right? And where I would see groups walking along, when one student had a mask on, they all had a mask on. So please encourage each other to do the right thing, as nearly all of you are doing. And I'm just really grateful for that. And we really need to see that continue.
Wonderful. Thank you. Anita, anything you'd like to add?
Absolutely. I'm very appreciative of the leadership that we do have. Chancellor Jones, Provost Cangalaris, our SHIELD team, but definitely our students for stepping up, our parents and families who have gotten involved, our alumni who have supported us. I mean, people really want us to be successful, and the entire community, the Chambana community has really come together to really help us and help our community, because we are the community, move forward with our academic lessons. And I'm just really appreciative of everybody's commitment to making sure that we are supported and that we are definitely resourced to help our students. But I also forgot to mention one thing, Robin, if you don't mind me saying it.
Not at all.
we're so focused on COVID, we're so focused on our mental health issues, but we do have other issues that do come available and other crisis issues that come available. So I do want to make sure that people understand that we do have crisis services available, particularly for our sexual misconduct survivors, and that the Women's Resource Center, they are conducting in-person and virtual appointments. So that is available, and they are very fully confidential. So I want to make sure that we put that out there, that the Women's Resources Center still is offering those crisis services available to our students.
That is great. Thank you. And I think we're going to wrap it up now. Chancellor, would you like to say anything else to students as we sign off?
No, other than thank you, as I said earlier, for all that you've done to help us navigate this pandemic. Please stay vigilant. Please think about protecting yourselves and others. And please do all those things that we ask you to do. We're not trying to see how many hoops we can have you jump through. This is all about meeting the goals and objectives that we heard from you and your parents about providing as much face-to-face education, providing as much opportunities for you to engage. We're thinking about new and innovative ways to mitigate the fatigue from being in isolation and quarantine. We are really getting close to the red zone, folks, to use a football analogy, and being successful here. We don't have time. We can't afford to fumble. We really have to continue to drive with the overarching effort of keeping this community safe. And we look forward to working with you to achieve this strategic goal in the months ahead. Thank you all so much, and we will see you soon. Don't forget to return to deliver your 2 negative COVID-19 tests. That is a personal request for me as your chancellor. Thank you very much.
Thank you, Chancellor. So thank you, Chancellor. I want to thank Andres Cangaleras, Danita M.B. Young, Stephen Bryan, and Alice Carey. They were our panelists today. Also, thanks to Allison Vance, Chris Harris, August Chess, and Katie Watson from Public Affairs, Chantel Thompson from Student Affairs, and Brooke Nunn, who has been doing the live captions for us today. Again, quick shameless plug. Remember, begin testing as soon as you're back on campus. And as the Chancellor said, 3 days apart, 2 negative tests. As always, all of the briefings we do are recorded and posted to the covid19.illinois.edu site. I hope you all can get outside and safely distance and enjoy this sunny afternoon for a little bit. Thank you so much for joining us, and have a great semester.